Hello, everyone. This video is on sciatica and CBD. My name is Brianna Flores. I'm a PA, health coach, stay-at-home mom, and Green Compass CBD advocate. And I did not start my timer, so I'm going to because I want to be mindful of everyone's time. So 15 minutes, here we go. All right, so sciatica, right? Something that I used to see in clinic all the time. Generally speaking, right after someone has had all like alarm conditions ruled out, right, for their back, hip, and their leg pain, the patient is left to deal with this uncomfortable condition on their own, which can be debilitating. It can be depressive. It can be, stimulate feelings of anxiety, isolation. This is a chronic condition. However, right, the most common remedies are NSAIDs, ibuprofen, maybe muscle relaxants, and those medications are not supposed to be taken long-term. So that, again, can be extremely frustrating for the individual, not to mention it's dampening and diminishing the quality of life. So I want to talk about getting to the root cause, right? And obviously there can be various reasons why someone is experiencing the pain of the impingement upon their sciatic nerve, but they all share something in common, whether it's from an old injury or you actually do have like, a herniated disc or, whatever it might be, it's inflammation. And so I want to speak on how you can start to manage your sciatic pain by decreasing your body inflammation. So, and I'm going to speak to it from a holistic standpoint, right? Opposed to relying on those NSAIDs, because NSAIDs are not benign, folks. They carry side effects, okay? These are drugs like ibuprofen, Advil is ibuprofen too, naproxen, and then again, right, the other options are those muscle relaxants. And those have side effects of like drowsiness and dizziness, confusion. You shouldn't be driving on those. Like that is impacting quality of life. Again, the NSAIDs, they're damaging your microbiome, which is all the bacteria within your stomach that is super, super important for your immune system and your mental health. NSAIDs are decreasing mucus production, which is so protective for your stomach. That's why when we're taking those 800 milligrams of ibuprofen, you start to literally like get a stomach ache because it's damaging your guts, y'all. It can cause ulcers, it can cause GI bleeding, okay? And this is obviously with chronic use, but if this is a chronic condition, what else am I supposed to do, right? Which is where a lot of people that deal with this condition are left feeling. So what can you start doing to help decrease your full body inflammation from the inside out? I'm not only going to be talking about CBD, but I'm also going to give you some other tips and tricks that you can start doing today, okay? So super hydration. I recommend investing in some type of stainless steel water jug, and then adding some pink Himalayan salt within it for additional electrolytes. When we are dehydrated, this is leading to electrolyte imbalances and also facilitating more inflammation. And so what you want to do is take your body weight in pounds, divide that by 2, and that's going to give you your minimum amount of fluid ounces that you should be drinking generally before noon or 1 p.m.-ish. Soda, tea, sweetened drinks, coffee, that does not count. It has to be water with electrolytes. And add your own electrolytes because that's the cheapest method opposed to like buying an electrolyte drink because it might come with sugar and a bunch of other stuff that we don't want, okay? Furthermore, when you're hydrated, that's going to allow for the joint to be properly lubricated, and it's going to help lessen any type of arthritic pain or back pain. Step 2 is motion and stretching. Okay, so gentle stretching can really reduce the stiffness within your body because when you're dealing with pain, right, in your sciatic nerve area, you start to compensate and utilize other muscle groups within your body because you're trying to like not move the area that's in pain. And that can lead to a lot of muscle tension and then pain in other areas of your body, right? And so by moving and staying in motion and gentle stretching, this is going to boost your body's joint mobility. It's going to promote lymphatic drainage, increased blood flow to those areas, which is going to bring oxygen to the area. And it's going to help reduce muscle tension and spasms. I do want to say though, right? Some people will say, I'm in so much pain, I can't go for a walk. Enter CBD, you can help diminish that pain and you can start being in motion and you can start stretching, okay? Step 3 is intermittent fasting, okay? So yes, intermittent fasting can help decrease your sciatic pain because it is anti-inflammatory, guys. When we practice a minimum of 12-hour daily fast, which is 7 p.m. to 7 a.m., you are putting your body in a stressful type of state, but it's a good stress. We need a little bit of stress. And so what that does is decrease body inflammation. It's giving your body time to reset and digest and just chill out, opposed to always being like, I'm working on something. Men, you can shoot to 14, 16-hour fast. Women, you can do 12, 14-hour fast. If you are premenopausal, make sure 7 days before your bleed, you are not fasting. Your body's already going through enough stress during that time. If you're postmenopausal, dealing with sciatic nerve pain, you can do 12 to 14 hours. You could do 16 hours. Listen to your body. Everybody is different. I do recommend starting low and slow. So start off with 12 hours first and then work your way up as your body tolerates. But again, that restriction of food is going to be the most effective way to really regulate inflammation. And then fasting actually is beneficial for our microbiome, opposed to damaging it, which again, that's what that ibuprofen does. It damages our gut microbiome. And then step 4 is taking that daily CBD regimen. So the CBD is not to be utilized as an ibuprofen, kind of like on an as needed basis, okay? And the reason for that is because we want to ensure that we are loading our CBD receptors every single day, okay? And so generally people who are experiencing pain every day, or even flare-ups 2 to 3 times a month, I do recommend the Balance and Restore bundle from Green Compass. I'll go into detail what that is in just a second. But I'm going to speak very quickly about our CBD and how it's different from other CBDs, because not every CBD is created equal. 9 out of 10 bottles are mislabeled. The hemp flower plant is a scavenger plant. This is not marijuana, y'all. You will not get high on this stuff. It does not cause any psychoactive properties. You can drive on it. I give it to my daughter. Okay, she's 2. And I'm really picky when it comes to supplements. And this company is USDA certified organic. They test for heavy metals, herbicides, and pesticides. They're family owned, USA grown in Wilmington, North Carolina. And each product has a scannable QR code on the bottom that you scan with your phone, and you're able to pull up the certificate of analysis for that particular product, and you get to read exactly what's in there. And so that's great, right? Because if you're utilizing something in efforts to diminish pain, inflammation, and optimize your quality of life, you want to make sure that it's the best quality, because you're investing in it. So this bundle comes with the nano jellies and a CBD oil, 2 of our best-selling products. And it's priced at $159 as a preferred customer, meaning, and you don't have to pay for anything to become a preferred customer. It just means that it's on auto ship every month. You can pause and cancel it or swap out products if you want to try a different product at any time without any penalty. And again, the jelly and the CBD oil are going to work synergistically at reducing the pain and the inflammation so that you can start stretching, so that you can start taking a walk every day outside. If you do 159 divided by 30, that's priced at $5.30 a day. And you're getting 2 doses out of that. Okay. And so I generally recommend for someone who is struggling with a lot of pain or frequent flare-ups, 1 jelly in the morning, CBD oil at night. But again, dosing can be discussed from person to person based off of, you know, the way that they're feeling, their symptoms, history, things like that. And the other thing though is, even though the dosing might be different, I'm still going to be like, hey, you still have to make sure you're taking it every day. But dosing can vary. So how does CBD actually work for sciatica. So everyone does have something in their body called an endocannabinoid system. Our body naturally makes cannabinoids. And this is a more recent discovery. When we breastfeed, we make cannabinoids. When we are working out, we make cannabinoids. And that's that feeling of bliss and peace, right? But unfortunately, our endocannabinoid system does get thrown off. It gets thrown off by traumatic experiences, stress, injury, toxins, right? So sciatic pain is definitely a stress. It's an injury. It's chronic, right? And so CBD is able to, by taking it every single day, fill our endocannabinoid systems, bringing our body back into homeostasis and balance. And what that's actually doing is it's going to decrease the pain signaling that an individual is experiencing with sciatic nerve pain. And it's also going to decrease inflammation because it's calming your nervous system, okay? And so the other component that CBD helps with, right, is I know a lot of people that have a chronic condition develop anxiety around the anticipated pain. They wake up in the morning, they might not be in pain yet, but they're already getting anxious about the pain. They're like, oh my gosh, I have to go, or I'm going to the zoo today with my grandchildren and I'm not in pain yet, but I'm anxious. Like when I get there, you know, what is my body going to be saying and doing? And I'm going to have to stop and take a break. And then, you know, all of those types of things. CBD helps to reduce anxious feelings. And so it essentially is working from a standpoint of reducing pain, reducing inflammation, and reducing anxious feelings around your condition. So even though CBD does work like an NSAID, you're not going to be taking it like an NSAID. You're going to take it every day. And the cool thing is CBD, the side effect profile is so low. Okay. Like you could experience some drowsiness and all that means is you just need to reduce your dose a little bit. But it's not going to be irritating your stomach. It's not going to increase your chances of a GI bleed. And it's going to help reduce those anxious feelings around your current condition. So I hope that was informative in regards of how to reduce pain and inflammation within your body from a holistic perspective to help manage your sciatic nerve pain. Again, make sure you're staying hydrated, the daily CBD regimen, start fasting, and then keep your body in motion and doing some gentle stretching. If you do want to place an order, you can go to greencompass.com and then you can use my checkout code, which is 444277. That'll give you $10 off of your first order. If you sign up as a preferred customer, you get an additional 20% off. If you want more information or a personalized recommendation, kind of like a mini health consult, if you will, I'll ask you some questions. And you can email me at my email right there. You can take a screenshot of it, or you can get onto my Instagram. My handle is brflores38, and you can send me a direct message on there. And I will provide you kind of like a free mini consult, getting to know you a little bit better, what your needs are and what you're looking for. And then I can help you place the order as well. I hope this has been beneficial, y'all. Thank you so much.